The magnitude of the problem of sports-related concussion has been brought into increasing focus in both the general public awareness and in scientific investigation. This has resulted in a sharp rise in the number of publications on the topic. With this, numerous evidence-based guidelines have been generated which have focused on facets of clinical care, including sideline assessment, diagnostic evaluation, clinical management, and prevention of secondary concussion. Recognizing that primary injury prevention is an essential tenet of trauma systems, a multidisciplinary working group representing the Committee on Injury Control and Violence Prevention of the Eastern Association for the Surgery of Trauma undertook a systematic review of the literature pertaining to the primary prevention of sports-related concussion in pediatric and adult amateur athletes. 7 a priori PICO questions were formulated to evaluate concussion education in pediatric and adult amateur athletes, type of head protective equipment in pediatric and adult amateur athletes, rule modification governing high-risk activity in pediatric and adult amateur athletes, and exercise to increase neck mask in adult amateur athletes. A search of the literature from 1985 to 2017 identified 31 studies relevant to these 7 PICO questions, ranging from one relevant study to questions 2 and 7 to 14 studies relevant to question 4. Grade methodology was then used to evaluate the quality of the literature and to generate recommendations. This systematic evaluation determined the existing literature to range in quality from very low to moderate. In grade methodology, quality of the evidence is one of 4 factors that contribute to the strength of recommendations. The other 3 factors include a balance of desirable and undesirable effects of the intervention, the values and preferences of the target population, and the cost of intervention. In consideration of these 4 factors, for the 7 PICO questions, the following recommendations were made. Conditional recommendations for concussion education for both pediatric and adult amateur athletes, for rules governing high-risk activity in both pediatric and adult amateur athletes, and for exercise to increase neck mask in adult amateur athletes. Strong recommendations were made for head protective equipment in both pediatric and adult amateur athletes. Due to the higher quality of specific studies, 2 additional corollary strong recommendations are made in support of newer helmet technology in American football for adult amateur athletes and rules prohibiting body checking at younger ages in ice hockey for pediatric athletes. The working group concluded by recognizing advances that have been made in the evidence to date and calling for increased focus of investigation into further identification of effective interventions for the primary prevention of sports-related concussion.